your attention.
Okay, let's get started. Good morning, everyone, and welcome. It is Wednesday, June 18th, 2025. This is the regular public business meeting of the Lincoln County Board of Commissioners. I'm Claire Hall, Chair. Commissioner Casey Miller is here, along with Commissioner Walter Chuck, and that constitutes a quorum of the board. We begin with two recognition proclamations today. The first one is the observance of Probation and Parole Week, July 20th through 26th. Tony Campa, our Community Justice Director, is going to make the presentation, and while Tony comes forward, I will read the resolution. Whereas juvenile and adult community supervision is an essential part of the criminal justice and public safety system, and whereas Lincoln County community justice professionals uphold the law with dignity and affirm the right of the public to be safeguarded from criminal activity, whereas LCCJ staff hold adult and juvenile justice involved individuals accountable, and LCCJ staff help the county and the criminal justice system enhance community safety, reduce criminal activities, and help the community make effective use of public resources, whereas LCCJ staff protect public safety with care and concern. They are trained professionals who arrange or provide services and referrals for prevention, intervention, and behavior change services to justice-involved individuals, and work in partnership with community agencies and groups, which are effective in reducing criminal behavior and recidivism. And whereas LCCJ staff support victims and advocates for the restoration of communities harmed by crime and delinquent behavior, now, therefore, the Lincoln County Board of Commissioners proclaims July 20th through 26th as Probation, Parole, and Community Supervision Week in Lincoln County in honor, recognition, and respect for the dedication and contributions of the county's community justice officers and staff. Dated this 18th day of June 2025. Director Campa.
Well, hello. Thank you so much for having us here. I have a lot of our staff here from the Parole and Probation Office here. I've asked Steve Britt to come up and talk a little bit about what we do in our county here. He works in the Tides transition housing area, and we do a lot of great things, I think, in that aspect, trying to ensure that these individuals that are coming on probation and or from prison are having a place to stay and get their feet under them to help them be successful. Steve?
Yeah, so I think I speak for all staff and POs, when we see our job in two ways. Number one, it's to protect the public. Number two, it's to help our clients be successful. And part of that is our transitional housing. A lot of people, they get out of prison, they get out of jail, and they've got nowhere to go. And to not have a place to go is, what do people do? Typically, you go back to your old friends, you kind of do the same old things. So by providing that housing, we give them a launching pad to find employment. We assist with classes like cognitive behavioral interventions. We do thinking for a change classes. We direct them towards employment and that kind of thing. So I've got some pretty hardcore criminally minded folks that have been in the system for a long time, and they get out of prison. We provide them with housing, and I've had folks that really have taken advantage of it and have found full-time employment. They engage in treatment. It provides them with accountability. I've got folks that have gotten out, they've got a job, and a lot of these folks, they haven't had a job for ever, if ever. So they get full-time employment, they've got their own housing, they're out in the community. And a big part of, being able to transition from that lifestyle and back into what, we're the normies, right? And part of that, the issue that they have is not being able to integrate back into society. So, that we provide a means for them to do that with our housing. Yeah.
That's wonderful. I mean, I remember sometimes the state gives us money with a lot of very tight strings on it. Sometimes they give us flexibility, and we had some money available. Essentially, the state said, figure out what the number one cause of recidivism in your county is, and then use this money to try to address it. And that's how we got the first three Tides houses. And then we were able to get a fourth one a few years ago. And I'm really glad to hear this. It just confirms everything I've heard ever since we opened these homes, that they are life-changing for the individuals and strengthening public safety in our communities. So, well done. Commissioner Miller, any questions or
Yeah,
comments?
Yeah. Well, thanks to, the whole team. Uh, and maybe just a couple of questions as community members, some advice as employers, how should we approach and think about these individuals that are trying to change, right?
Sure,
Any
sure.
key tips for us?
Absolutely. We, when people get involved with criminal activity, a lot of times, obviously they make really bad choices. Sometimes their appearance alone separates them from the rest of society. So I think having an open mind towards these people, giving them second chances as opposed to, just being focused on punishment. When you're just focused on punishment, you're not helping people to move forward. You have to provide solutions.
Yeah.
And so that's a big part of what we do is we provide options. We give folks options as opposed to, oh, this is how I am. This is how I'm going to be. I'm never going to change. We don't believe that,
Yeah.
and so we provide them with those options. And part of that is like with the cognitive behavioral stuff that we are able to do with them. Just opens up their mind, hey, you think this is your only option. What about this over here? But as far as I think as society, it's really important that, when these folks come out into the community, that we're able to go, you know what? I'm going to give this person a chance. I'm not going to judge them based on their appearance alone. I think that's a big part of their issue. This is how I look. This is how I feel. This is how I'm going to be.
Well, it seems like you are kind of the Swiss Army knife in the equation. And just appreciate all the work, recognize that work, and be sure to let us know how we can, optimize those second chances as a board. I think we're receptive to doing that and supporting you. So thank you.
Yeah.
Yeah.
Commissioner Chuck?
Yeah, thank you, Tony. Thank you for the ride along, and Officer Britt. That was very eye-opening. See what our community is going through. Can you highlight a little bit more on your work with at-risk youths and providing a better path forward for them and those just over the age of 18?
So, we with our youth, we're really focusing on restorative and diversion type, avenues, to try to keep them out of the court systems as much as possible, especially those people those youth that are unadjudicated. That's really going to be the focus. We're really working on treatment and cognitive-based programming. With our adults, we just recently had Steve Britt and Will Crispino attend and successfully complete a course to be facilitators and thinking for a change. It's evidence-based practices. It's a proven model to help individuals recognize those paths that they're going down that are make them be more successful and be more productive.
Thank you for that. I think providing them with some other alternatives and a better path forward is, starting when they're young before they become more habituated. Just want to thank you and your team for keeping the community safe and appreciate what you do and your officers. So thank you.
And I'd like to say
Sure.
the week of July 20th, we're going to have a barbecue. It's usually on a Wednesday. So please be on the lookout for that. We invite the public. We like anyone to be able to come. We have good food and we do a little bit of cornhole and that type of thing and, mingle and talk to staff.
And that's right across the street in the parking lot at your offices, correct?
Correct.
Yeah.
Yes.
All right.
So
We'll
thank
look
you.
forward to that.
Appreciate it.
I believe we're ready for a motion now on this resolution.
Sure. Want to go for
Go
it?
ahead.
All right. I would move that we proclaim July 20 through 26, 25 as probation, parole, and community supervision week in Lincoln County.
I'll second that motion.
All in favor of the motion, please say aye.
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 It
Okay.
is approved unanimously.
Thank
Thank you,
you.
gentlemen.
Barbecue coming.
Thank you.
Okay, next up is a recognition of National HIV Testing Day. And Commissioner Miller, would you like to do the honors on this proclamation, please?
I will indeed.
Thank you.
Recognizing June 27th, 2025 as National HIV Testing Day. Whereas HIV testing is observed each year on June 27th to raise awareness about the importance of HIV testing and early diagnosis. Whereas each year in Oregon, approximately 240 people are newly diagnosed and 8,242 are living with HIV. An estimated 1 in 7 people living with HIV in the United States are unaware of their status, highlighting the need for increased access to testing and public education. Early detection through HIV testing leads to timely medical care, improved health outcomes, and reduces transmission. Whereas HIV affects people of all ages, races, genders, and sexual orientations, and reducing stigma and encouraging open conversations about sexual health are essential for prevention and care. And whereas, in partnership with our community, the Lincoln County Public Health works to provide free, confidential, inclusive, and accessible HIV testing at fixed sites and other locations throughout the county. Whereas this year, Lincoln County Public Health is partnering with Kaiser Family Foundation, Walgreens, and HIV Alliance to provide free HIV testing and resources in Newport and this National HIV Testing Day. Now, therefore, we in Lincoln County, the Board of Commissioners, proclaim June 27th, 2025 as National HIV Testing Day in Lincoln County and urge everyone to learn more about HIV, get tested, and support efforts to end HIV in Lincoln County.
Thank you, Commissioner Miller, and welcome. If you'd all introduce yourselves and take it away.
Thank you. My name is Shelby Knife. I am the Disease Prevention Harm Reduction Program Manager for Public Health and Health and Human Services.
I'm Angela Harson. I am a Harm Reduction Services Coordinator for Lincoln County Public Health.
And I'm Janet Pushkar. I'm the nurse for our harm reduction program for Lincoln County.
Great. I just have a few comments. Good morning, commissioners, colleagues, and community members. Thank you for the opportunity to speak today in support of the proclamation recognizing June 27th, 2025 as National HIV Testing Day in Lincoln County. Each year, National HIV Testing Day reminds us of something simple yet powerful. Knowing your HIV status saves lives. It's a day to raise awareness, reduce stigma, promote access to testing as an essential step in public health. The good news is HIV is preventable, treatable, and no longer a death sentence. With early testing and diagnosis, people can access care and treatment that allows them to live long, healthy lives. Still, the stigma around HIV and sexual health can create barriers to prevent people from seeking testing and treatment. And that's why education, visibility, and community partnerships matter so much, especially in rural areas. The most concerning statistic to me is that 1 in 7 people in the United States who have HIV don't know it. That means there are thousands of people living without the care they need and without realizing they could be transmitting that virus to others. In Lincoln County, the Public Health Division of Health and Human Services is working hard to eliminate those barriers. We offer free, confidential, and inclusive HIV testing through community outreach and through our harm reduction fixed site locations. This year, in honor of National HIV Testing Day, we're proud to partner with the Kaiser Family Foundation, Walgreens, and the HIV Alliance to host a testing event in Newport at the Walgreens Pharmacy from 11 a.m. till 6 p.m. This will be a chance for community members to get tested, access resources, and ask questions in a welcoming, non-judgmental space. I want to thank the board for recognizing the importance of this day and for standing with us in an effort to end the HIV epidemic. I encourage everyone in Lincoln County, whether you're a healthcare provider, a first responder, a parent, a young person, or a community leader, to do your part. Get tested. Talk about sexual health and how to prevent the spread of HIV and other sexually transmitted infections. Support those living with HIV and help create a county where no one is left behind because of fear or misinformation. Together, we can break down this stigma, improve health outcomes, and support a healthier, more informed, and more compassionate community. Thank you.
Thank you. Anything to add?
No.
Okay. Commissioner Chuck, any questions, comments?
Just thank you for providing the services and look forward to seeing how many people show up in June. So thank you.
Yes, we are too.
Commissioner Miller.
Yeah, so comment and question. It's been a long time since I've had my HIV test. I was in my late 20s, went to the health department, but a lot of time has passed. So I'm curious, how often should you get tested if you've been tested once? And what would I be thinking about to motivate me with that kind of frequency of testing? Like, what are your thoughts?
Well, there are a few things.
Okay.
You want to go? You want me to go? I'll go. So there's a few things. One would be lifestyle.
Okay.
If you're living a lifestyle with multiple sexual partners, if you're an IV drug user, those sorts of activities, you would want to get tested more frequently.
Okay.
If you are in a monogamous relationship with someone that's not cheating on you, right, then you could do testing less often.
Okay. Helpful.
And it's interesting, since doing this, I got tested,
Yeah.
and there is some nervousness
yeah.
and stigma
Everybody
around it.
nervous.
We're doing it in our meeting, and I'm like, oh man,
Yeah.
yeah.
Well, and I think maybe a good little follow-up here is what if and reassurances for what if. I mean,
Yeah.
The really great thing is the what if is when we partnered with Walgreens
Mhm.
and the HIV Alliance is going to be here on that day. So if anybody does come positive or has questions that we can't answer,
Sure.
we can actually walk them over to two individuals from HIV Alliance.
Yeah.
They can fill out the paperwork or ask them any question that's needed. So there will be services available
point.
that day.
Excellent.
So it's really cool.
Immediately.
thank you so much. Great point. I have
Yep.
nothing more.
We're ready for a motion then.
So I would move that we recognize June 27, 2025 as National HIV Testing Day.
And I will second that motion.
We have a motion and a second. All in favor of adopting this resolution, please say aye.
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 Thank you very much.
Thank you.
Yeah, keep up the good work.
Next, we move to the consent calendar. These are routine items that have been discussed at previous meetings. Are there any individual items that commissioners would like to either pull for individual consideration or highlight?
Chair Hall, nothing for me. I approve it as is.
I have none.
Okay, then let's have a motion, please.
I would move that we adopt the consent calendar as presented.
I'll second that motion.
All in favor, please say aye.
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 All right. Now we move into a series of public hearings, not only on the county general fund budget, but the budgets for the individual districts that are separate from the fund, but also governed by the commissioners. We did have 3 public hearings of the Budget Committee and had an opportunity for presentations and questions, but this is the final step in the process. By law, we have to have an adopted budget before the beginning of the new fiscal year, July 1st. This is our last meeting before then, so first off, I will open a public hearing on adoption of the 25-26 Lincoln County budget hearing. Do we have anybody online or in the audience who wants to testify on this hearing?
If you are online and would like to provide public comment on the budget hearing, please use the raise hand function on Zoom.
Commissioners,
Nothing
any
for me.
questions, comments?
Mm-mm. Well, thank you.
All right, a motion, please?
Close the hearing.
Oh, yes, I'll close the hearing. Thank you for catching that. And now we'll go for action.
I'll move that we adopt the fiscal year 2025-26 Lincoln County budget.
I'll second that motion.
All in favor, please say aye.
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 All right. Next up, I'm going to open a public hearing on adoption of the Lincoln County Extension Service District budget. Anything from commissioners on this one? Anybody who wishes to provide public testimony on the extension budget? All right, I think we're ready to close the hearing and I'll entertain a motion.
I would move that we adopt the 2025-26 budget, making appropriations, levying taxes, and categorizing that levy for the Lincoln County Extension Service District.
I'll second that motion.
All in favor of the motion, please say aye.
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 All right. Solid waste? Yeah. We're on to the solid waste disposal district budget, and I will open that public hearing. Let's see if there's any public testimony specifically on this budget. Any questions, final comments from commissioners before we act?
Mm-mm.
I do not.
All right, I'll entertain a motion, please. Oh, yes, and close the hearing.
You-
Mhm.
So I will move that we adopt the fiscal year 2025-2026 Lincoln County budget for the solid waste disposal district.
And I'll second that motion.
All in favor of the motion, please say aye.
Aye.
All right. We're on now to the Animal Services District budget. I'll open that public hearing. Let's see if there's any public testimony, comment. Okay. Anything from commissioners?
No, thank you. I would
Okay.
move that we are
I'll
going to close it.
close the hearing. Yeah.
Close hearing. Okay, great. I would move that we adopt the 2025-26 budget for the Lincoln County Animal Services District.
I'll second that motion.
All in favor of the motion, please say aye.
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 All right. Now we move on and I'll open the hearing for the Transportation Services District budget. Any public testimony on the Transportation Service District budget? Anything from commissioners?
Nope.
I'll close the hearing then and I'm ready for another motion.
I move that we adopt the fiscal year 2025-2026 Lincoln County budget for the Transportation Services District.
Okay, I'll second that motion.
All in favor, please say aye.
Aye.
All right, one more, and that is the Siletz Area Enhanced Law Enforcement Services District budget. Again, I'll request if there's public testimony on this specific budget. Anything from commissioners?
No, thank you.
I'll close the hearing and we're ready for a motion.
Okay, I'll move that we adopt the 2025-26 Siletz Area Enhanced Law Enforcement Services District budget.
I'll second that motion.
Okay, a motion and a second. All in favor, please say aye.
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 Aye. Okay, we're done with budget for another year. The next action item is a drought declaration. We put this on the agenda as a placeholder, but I understand our drought committee is still gathering some more information. They're not ready quite yet to make a recommendation to us. So that is why we're not acting on that. Now,
Likely to see it down the line here. Okay,
yeah,
thank you.
now we move on to reports. The first one, Lincoln County Medical Examiner's Office report. And will our presenters please come forward?
Morning.
Welcome.
Hello.
If you'll introduce yourselves, and the floor is yours.
So I'm Dr. Jerry Robbins, and I'm the Lincoln County Medical Examiner.
I'm Cassandra Mumford. I'm the Chief Medical Legal Death Investigator for the Medical Examiner's Office.
And I'm Lydia Coe. I'm a medical legal death investigator for Lincoln County.
Okay.
Morning.
Yes.
Oh, is your red light on?
Yes.
Okay, red light's on.
Do we pause
Okay.
it?
All right.
Can you hear me okay?
A little bit better.
Mhm.
It isn't loud. Thank you.
So next slide. So while, I don't know if you have access to these slides.
Yes, they're part of our meeting packet.
So while you're speed reading this, I think what we want to say is we are here to introduce ourselves, to introduce you briefly to what we do, how we do it, and what we've accomplished this past year, almost a year.
Good, thank you.
Next slide. So the medical examiner's office investigates deaths, unattended deaths, sudden, violent, unexpected, suspicious deaths that occur in our county. It's my job ultimately to certify deaths. So that's the end of the story. We'll get to the beginning of the story in just a minute. I guess I want to say certifying somebody's death is something, first of all, that's mandated. That's why we're here. That's why you have us here. And it involves a lot of details to certify somebody's death. So, next slide. The next thing to say is that I am the medical examiner. There are two assistants for Lincoln County, Dr. Michael Swift, who is a local OBGYN doctor, and Dr. Peter Kenyon, who, like me, is sort of retired and lives in Albany, we think, maybe Corvallis. He's a colleague, and we used to work together. So on this slide, you will see that in each county there, according to Oregon statute, in each county, there shall be a medical examiner for the purpose of investigating and certifying the cause and manner of death, requiring investigations. If you go to the next slide, here's what's new and important that's happened since July 15th. In Lincoln County, in the medical investigator's office. So I'll let Cassandra explain.
Okay, can you hear me? Okay. Again, my name is Cassandra Mumford. I'm the Chief Medical Legal Death Investigator. I have currently two part-time medical legal death investigators, Lydia Coe and Jalen King, who's not able to be with us today. Our job as medical legal death investigators are, we are trained in death investigations, both on the medical and legal side. So we basically are the eyes and the ears for the forensic pathologists at the state medical examiner's office and also for the county doctors. Not typically, doctors don't typically go to the scenes. So we're trained, we go to the scene to help the county MEs and the state medical examiners determine the cause and manner of death. So I'll go into exactly what we do. So next slide, please. So medical legal death investigators, oh, that's not the slide that I went to. That's okay. I'll let you do this slide.
Sure. So I am a medical legal death investigator, and the first thing that I need to do is I gather as much information as possible as far as the cause, manner, and mechanism of death, and then I present that to Dr. Robbins here. And we have to determine jurisdiction, whether or not a death is natural or unnatural. And that involves a lot of work. Even if we don't take jurisdiction over a case, we still have to do a lot of preliminary investigating. And that, you can just read this. We also serve the community and provide next of kin with a lot of answers as to why their loved one passed away. And it helps determine we help determine who the next of kin is. And that's a large part of being a medical legal death investigator and our responsibility. We also will coordinate transportation to the funeral home or the state medical examiner's office. And we communicate with families regarding autopsies and toxicology results.
Next slide. Okay. So the county medical examiners and medical legal death investigators also work closely with the state medical examiner's office. The state medical examiner for Oregon is Dr. Sean Hurst, and under him, he has 4 deputy state medical examiners. So they are the ones that are conducting the autopsies in Clackamas. They also will review our reports in our database system. So whenever we determine a jurisdiction on a case, even if we release jurisdiction on a case, they're still reviewing it to make sure that we're doing a thorough death investigation and that nothing gets missed. So they do review our reports, and anytime that is a case that would be need to be seen at the state medical examiner's office, they will review those cases. And then we also have a forensic anthropologist for any cases that are related to a bones case where a decedent is found in skeletal remains. Next slide. So what exactly is a medical examiner's case? So this is the statute ORS 146.090. I won't, the next slide will get more into what exactly, but this is the statute that we follow. Next slide. So the common type of death investigations that we do is natural, not currently under the care provider within 1 year prior to death. And we do see that a lot out here in Lincoln County. There is a lot of elderly community members that do not have a primary care provider. So we are that is the majority of our cases that we are seeing. We also do suicide cases. So, and then accidental deaths, motor vehicle accidents, overdoses, homicides, deaths of prisoners, deaths that are suspicious in nature. We'll investigate those as well. Some unexpected deaths during a surgical procedure. So in a hospital where, something possibly have gone wrong, those deaths are reported to us. Unexplained infant deaths, we investigate those. Thankfully, we haven't had any of those in the last year. Next slide. So the county level medical examiners cases, because there are difference between the county levels and the state levels. So usually what we're seeing at the county level again is the natural deaths. So decedents are not under the care of a primary care provider, or deaths that are where anytime someone dies at home, they're not typically, there isn't a provider there, there isn't a physician there. So per the statute, those are reportable deaths to us. So, if someone dies at home, they have an extensive medical history, but they're under the care provider that they've seen in a year, we will release that death certificate to their primary care provider. We are seeing the majority of those deaths that happen are individuals that do have, are under the care of a doctor. But the important part of what we do is those deaths are reported to us. And then their primary care provider can call us and say, hey, I want to know what happened to my patient before I feel comfortable signing this death certificate. So what we do is when those deaths are reported, we review the medical records. We will look over those records to make sure that there's nothing in their records that would make them a medical examiner's case. And then we also confirm that they're under the care of a provider. So when, a provider calls us, we'll go over the circumstances that is reported to us from law enforcement. There's nothing suspicious at the scene, no suspicion of drugs, alcohol, accidents, anything like that. So that helps. And we also communicate that to the families, because we get a lot of families, of of individuals that die at home. They have an extensive medical history and they're like, oh, I want them to go for autopsy, but there's really no reason for them to go to autopsy if they have an extensive medical history. We're also seeing, we do unfortunately get a lot of suicides out here. So we investigate those at a county level without any suspicious circumstances. If it's suspicious, then we'll go over the death with the state medical examiner's office. Apparent accident or following an injury. So those are motor vehicle accidents. Those are, an elderly person that falls down and fractures a hip or have some kind of subdural bleed inside of their head. We're assigning those because those are considered accidental deaths. We usually only will certify them at a county level if there's no criminal charges pending. If there's criminal charges like in a motor vehicle accident, we do send those cases to the state medical examiner's office. Suspected drug overdoses, if there's no criminal charges pending in those cases, our county medical examiners will send that, will do the pending death certificate. And once that toxicology comes back, then the death certificate will be amended with the cause and manner of death with the toxicology results on that. Next slide. This is a very busy slide, but this is kind of just going into exactly what happens when we receive a call. I'll go more into it into detail. Okay, next slide. So the preliminary death investigation, we received the call either from dispatch, hospice, care facility, nurses, law enforcement. We gather information if it's going to be a medical examiner's case versus if we're going to release. If we assume jurisdiction, we're going to go to the scene. Some cases, such as, like I said, someone that dies at the hospital, 3 days later from a hip fracture or something like that, we're not going to go and see them. We're going to request medical records, and that's going to be considered a medical record review. And same for hospice deaths. We just kind of go off the medical records. But all other cases, even like natural deaths not under the care provider, we're going out to the scenes to make sure we're doing a thorough investigation. So if there is a scene of response, we arrive, we investigate the scene, we interview anybody at the scene, we photograph the scene, we photograph the decedent, we do a body exam. We make sure we confirm identification if that's really important that we're identifying these people correctly. We obtain post-mortem or anti-mortem specimens if we need those for toxicology. And we determine disposition. So are they going to be just released to the funeral home assigned at a county level, or are they going to need to go to the state medical examiners for an autopsy? Okay, next slide. And during the investigation, we gather medical history. We review medical records. Luckily, we have access to medical records, which is really helpful. Sometimes we don't, and it takes sometimes months to get records, but luckily we have access to Epic, so we can look at those thoroughly. We obtain law enforcement reports. That's important just because we want an objective documentation from another agency, not just ours, because we're doing 2 separate investigations. We report our preliminary findings to the county medical examiner or the state medical examiner's office. The toxicology specimens, we do label those and we send them to the state medical examiner's office for toxicology testing. After all of that's done, we enter all the information into the MDI log, which is our database. And this database is accessible for the state medical examiner's office, the county medical examiner's office. So it's in real time. They can look at our report, they can look at our photos, they can look at the documents. So that's really helpful. And it takes time, lots of time to do the data entry, gathering all this information and writing our final report. Next slide. So the importance of a scene response, we can't accurately sign in a death certificate if we're not responding to the scene. It is the National Association of Medical Examiners standards for MDIs to respond to scenes. And we want to work as a team with law enforcement, hospital staff, funeral homes, to make sure that we are doing a thorough death investigation. We want to work with law enforcement because we are trained in 2 different aspects. They're trained more on the criminal side, and we're trained in the medical and legal side of things. I've gone to scenes where, I may have looked over something in law enforcement, will be like, oh, hey, this is here. Or I'll go to scene and I'll be like, oh, hey, did you see this? Oh, nope, I didn't see, this methamphetamine pipe that's consistent with drug use. So, it's really important that we're working together. Next slide. So when it comes to if a person needs to, go for an autopsy, that ultimately the medical examiner, county medical examiner, and the district attorney can request an autopsy. But it's ultimately up to the forensic pathologist to determine if they want to do an autopsy or not. So anytime there's a request, even from the families, we'll still follow up with the forensic pathologist, and they ultimately have that decision if they're going to do one or not. Next slide. So this is just kind of our, since July 15th, when prior to me starting as the chief, what Dr. Hurst has said is, Lincoln County was operating in the old model where medical legal death investigators did not go out to the scene. And what would happen is the body would be released to the funeral home, and then that's where the body exam would take place if there was a body exam. And so now, since taking over, this is in this time frame, we've had 262 deaths reported to us. Death certificates released to the primary care provider is 150. So, as you can see, that's the higher number, but that's still, if we're releasing that death certificate, it still takes time to review medical records, enter the data and all of that. So that's about an hour to an hour and a half per that. County cases that we've signed is 95. So those cases can take anywhere from 5 to 12 hours to complete the death investigation completely. State cases where decedents are being taken to the state are about 17. Scenes that have been attended by medical legal death investigators within this time frame was 91, which is a lot. And during that time, we have a truck, which is really nice to have, so that we can also do the transport to the state. And before, the families were getting charged for that cost, and then it's about over $500. So having that truck has really helped getting cases to the state medical examiner's office and timing. So we're trying to do that the day after the person is declared deceased. Okay, next slide. So some of the accomplishments that we've had this past year, we have 3 medical examiners, chief medical legal death investigator. We have 2 part-time medical legal death investigators. The work truck has been really helpful because we keep a lot of our equipment in there. I've written 7 policies and procedures, which is big because the other medical examiner's offices I've worked at in Oregon, none of them had policies and procedures. So I'm really happy about that. Being able to get medical records requests in a timely manner, fingerprinting identification through the FBI. So if we get an individual that is unidentified, we are able to print them on scene, scan these and email the prints to the FBI, and we can get people identified within 1 to 2 days. And we have used that, and it's been very helpful, because prior to that, decedents, if they were unidentified, they had to go to the state medical examiner's office to be identified. I've created a death certificate user guide for our doctors so that they are signing death certificates accurately. I've also created a training manual for the death investigators. Some of the community connections that we have accomplished over the last year is vital records. So anytime like a death certificate is signed incorrectly by a primary care provider, such as like a hip fracture, they're putting this as a natural death when it's an accident. So we're able to communicate with them when that death certificate needs to be amended. Something that recently we started was with Donor, Solavita, and Cascade Life Alliance. This is a project that I'm just currently working on. So when an individual passes away and the next of kin grants permission and they've been released for donation by the county medical examiner and the state medical examiner, they are up for donation, which helps saves lives and ultimately. We also have been working on overdose and suicide reporting to Health and Human Services harm reduction. So we provide non-descriptive information about decedents that shows age groups of people that are taking their lives and also people that are, dying from substances, and looking at what we can do as a community to help the living. One of the goals that I'm currently set up with is suicide post-prevention, completing a scrap form, which is a mandatory state requirement that we're reporting adolescents suicides and overdoses to the state. But this form in the suicide post-prevention will also help with, families that are struggling with the death of a loved one, and they're helping with the resources. And do this slide.
Well, I think this is the end, which is to say, thank you in advance for your continued support of this program. For me, it was a sea change accepting this job as it is now with the support of the investigators and the support of HHS, so questions is the next order of business.
All right. Commissioner Miller, any
Thank you.
questions for our
Yes.
panel?
Well, thank you. This is like excellent, excellent overview. What a dynamic type of work, and so many things you do. Sorry if I missed this piece, but does the truck transport bodies or it does?
Yes, yes. We were able to get a canopy for the back of the truck. We got an insert for the back. We have a gurney. So sometimes the funeral home, they're busy when we're busy, obviously. But sometimes their staff can't respond to a scene for hours. Or we're in a place where we need 4-wheel drive. So in that way, we can transport from the scene to the funeral home and then also to the state medical examiners. Like I was saying, like sometimes the cost of the families was over $500 just to transport them. And I know the county was kind of eventually started paying for that cost. So my idea was to get this truck in place, have our part-timers or myself transport to the state, wait at the state medical examiner's office until that autopsy is complete to alleviate that cost. And it helps so much.
Yeah.
So, and I love having a truck. It's very helpful. We've gone into, some places where we need 4-wheel drive. I also have the back set up with all of our equipment, body pouches, handbags, anything that we may need on a death investigation where it's right there and we don't have to go back and forth to the office. So it's been very helpful having a truck.
Because it's very easy for, I think, if I'm probably not alone, to start thinking CSI, just, because this is what we see, right?
From movies and TV shows, yeah.
But what is it really? So it sounds like you've really tightened things up. The program's very foundationally strong. But what do you need moving forward? Do you anticipate any things that would be helpful to do what you do?
Yeah, so I think we have been approved for another full-time investigator, which is going to be very helpful because I, as chief, I'm doing the majority of the death investigations, the follow-up, and it's a lot. I don't think people really understand how much goes into a death investigation. And I love what I do, and I put all of my heart and soul into it to make sure everything is done accurately. Not only am I'm reviewing our part-time investigator stuff, both of our medical examiners, they're great, but I do review the death certificates to make sure that they're accurate. But I need support in a way that I can also work on these projects. So I have about 5 projects going on, and it's really hard. Like yesterday, I was able to work on a lot of projects and not get any reports of death, which is really nice. But if once I get, my full team up and going, which I think is just another full-time and 2 part-time investigators, that will really help me, give me time to concentrate on projects and helping the community. So just having that extra support, because it's really hard because we're on call 7 days a week, 24 hours a day. So, you can get a call in the middle of the night, but yet I still have to go into the office and do work and being tired all day. It's a lot. Sometimes I work 12 to 14 hours a day and it can be a lot. So having help with the death investigation so I can concentrate on all the meetings I go to and all the projects I do, that's what it's the balancing the work and life outside of work. So,
Yes.
yeah.
Well, you are obviously passionate about this work. It's important that it's accurate and that it's done.
Yeah.
No, I just appreciate everything and continue to let us know what you need.
You will.
Okay.
Thank you.
Commissioner Chuck, anything?
I'd just like to say, thanks. This was a great presentation, and you have a very under-recognized but vital service to the county. And Cassandra, thank you for getting your office better organized. It means a lot to the residents, and just thank you for what you do, and let us know how we can support you. Thanks.
I'd like to say thank you as well. Great presentation. I think you brought out the importance of the network of partnerships in this work and the importance of this work in many different angles. So thank you again, and we'll see you around, I'm sure, with something more.
Hopefully socially.
Well, yeah.
Lots of people don't like
but not
seeing us.
soon.
Yeah.
For them, the end is the beginning.
Yes,
Yeah.
yes.
All right. Well,
Keep it
thank
up.
you so much.
Yes, okay. And next we have a presentation, Lincoln County Climate Action Plan. And is our presenter ready?
Morning.
Morning.
Good morning.
As long as I have a Kleenex, my allergies are, there we go. Oh. Let's see, so is this on?
Yes.
Oh, great.
Red, yes.
Oh, awesome. So, good morning, commissioners,
Morning.
staff, and members of the public. Awesome to see so many folks here. I hope you're here for me, but maybe not. I'm Marianne Seifert from Lincoln County Public Health, Health Promotion Specialist. It's down. Okay.
Red.
I'm Sarah Hurd, Lincoln County Public Health Promotion Program Manager, and I've had the opportunity of working with and supporting Marianne through her work. So awesome. So today we're going to talk about what we've done so far. There's been a lot of work that we've built on over the years, and then end with what's next. So collaborators, we have so many collaborators on this work. Basically, I'm part-time and I use part-time of my part-time to do climate work. So we really relied on community partners. Martin Desmond, Citizens for a Better Lincoln County, Mike Allen, who's here in the audience. You'll hear from him later, I think, from Elders Climate Action Oregon. Tom Kearns, who's on our Lincoln County Public Health Advisory Committee. And then staff, Andrew Blair from Public Works, Dan Norton from Emergency Preparedness, Public Health, myself, Megan Off, who's back there, from Planning, and then Sally Edwards from the Sheriff's Office. They've been really key in our climate action team. And this team's been championed by Commissioner Miller. So back in 2018, Martin Desmond, Mike Brearley, Bill Kuch, and others created the 2018 Lincoln County Climate Action Plan. They did extensive community engagement. Their goal was carbon neutral by 2035. Also in 2018, there's a Lincoln County resolution. Commissioner Hall may look familiar to you.
Oh, yes.
So basically, this was to create or to convene a public-private partnership on climate change, public forums, policy creation, innovative solutions, and to update the BOC and the public. And then City of Newport also had one. And in 2022, 2023, Lincoln County collaborated with Benton County to hire consultants to do climate and health assessment. They hired Reed consultants. Reed used the Oregon Climate Change Research Institute projections. Those are like state of the art for Oregon. And then they also talked to a lot of folks about what are their community concerns. So respiratory issues came up, temperature. Even though people say, oh, on the coast, we don't have problems with heat, they've actually done research showing that coasties experience health impacts from heat at a lower temperature than folks who live inland. And elderly folks, folks with multiple health conditions, chronic conditions, people on certain medications are more vulnerable to heat. So even though we're on the coast and it's awesome, we still have heat-related concerns and cold too. Food insecurity is a big issue. Mental health, eco-anxiety, eco-grief, you probably heard those terms. Also stress from extreme weather events, disaster-induced stress, they call that. And also economic instability. What does our future look like? Are we able to continue fishing, farming? Folks who work outside are more exposed to the heat and to the weather. So there are a lot of concerns that the assessment captured. And using the assessment, we worked with Benton County again to create an adaptation plan. And this was funded by Oregon Health Authority, Public Health Modernization Funding. Without that funding, I don't think we could have done this work. And the partnership with Benton was awesome. So we developed strategies and actions. It's still pretty high level. And this is a visual from the report that I just love because it kind of captures everything and it's colorful. It appeals to my artist side. So one of the first things we did after getting these reports in the summer of 2023 was we formed a climate and health group of community members who had participated in the assessment. And then as I was out and about in the community, I would talk to people about climate change. And if there was anybody even a little interested, I got their contact information. So this group has been amazing. And we really kind of embodied this social resilience framework from Oregon Health Authority, basically working together, supporting each other, connecting with different communities, and really kind of that sense of belonging, that sense of place is so important to people, as I think that's one of the reasons we live here in this beautiful place. So, and we decided to do a youth work. We got some additional funding from Healthier Together Oregon to do some climate change focus groups with youth. They were a blast. Oh my gosh, those youth are awesome. The art you see in the report are from those youth. And we did them in English, Spanish, and Mom, thanks to community partners and Ruby Moon from the tribe. And then another priority population was older adults. As I mentioned before, they're more vulnerable to a lot of the climate impacts. And there's stigma. We heard from folks in terms of talking about mental health, but there was very little stigma about talking about emergency preparedness. Everybody gets that. That's sort of pragmatic approach. So that's how we decided to work with older adults, is focus on emergency preparedness, extreme weather events. And we would kind of weave in the storytelling and the mental health and the social connections. So, and Commissioner Miller, I ran into you in a parking lot, and I shared that, not literally running into you, but I shared that we had these reports coming out, and you said, please send them to me. And I did. And you said, okay, what should our county do? And I thought that was a great question, because the adaptation plan was still pretty high level. It wasn't really a work plan yet. So one of the things we decided to do was to have a staff survey about what staff wanted to work on. It's a best practice in this report I read from Cascadia Consulting, that you have leadership throughout the organization, not just at the top, but in the staff level also. So we wanted to encourage that. One of the things I love is that we got over 100 survey responses, including folks who didn't believe in climate change, which I thought was awesome, because to me that shows I'm not just preaching to the choir. And everybody had concerns about extreme weather. Everybody had experienced extreme weather, wildfire, smoke, heat, drought, flooding. Everybody had concerns about their kids or their elders, unhoused folks, people who work outdoors. And a lot of staff, the number one thing staff wanted was presentations from people who knew what they were talking about, which I thought was pretty cool. So we developed a Lincoln Lunch and Learn schedule with that. And 18 folks volunteered for the interdepartmental team. Unfortunately, not everybody had time in their day to actually participate. Megan's been just amazing, and Sally from the sheriff's office, and Dan and others, but they're doing it on top of their regular work, I think, so that's challenging. I think I'm the only person who's actually paid to do the work. Yeah. So there's a picture from our youth climate focus groups. I love that one. So we had those 18 people who said they wanted to be part of a team. So we convened the team, we identified goals. We wanted to not so much focus on the greenhouse gas emissions, but focus on building stronger communities, healthier communities, saving energy, money, and resources, and protecting the people and the places that we really love. People really resonate with that. And improving quality of life in general. How can we make places more walkable, greener, et cetera? So we use those survey responses I mentioned earlier to create a draft climate action plan. We created the Lincoln Lunch and Learn presentation series, and we used the information from the Lunch and Learns to inform the climate action plan. And then we also developed a take action checklist that's in the works. So in our climate action plan, these are some of the key actions we wanted to focus on. And this is staff. Using the staff survey and our work group discussions. Energy was key. How do we save energy? How do we be more resilient during extreme weather events? We wanted to explore solar options. On the picture on the right shows a parking lot, kind of carporty kind of thing that has multiple benefits. Not only are you collecting energy, saving money that way, but you're shading and you're sheltering from the rain. And so that was one of the things we'd love to work on, and maybe in the Commons might have an opportunity there. We want to identify renewable energy sources, microgrids. Here on the coast, we're very exposed, literally. Most of our energy in our two of our utilities comes from Bonneville Power. And as you saw during the ice storm, was that last year? 2024, I think. Time flies. We lost power for several days. Some places lost power for a week or two. Our energy is coming from Bonneville Power. There's so many ways that can be cut off, basically. So the concept of microgrids was really exciting to us. And that's something the Oregon Department of Energy is trying to promote. There's grants out there for that. Land use was a big issue. One of the things was, how do we encourage biking? We need to have facilities at our county buildings for the bikes. That seems simple and doable. And also to create a county-owned facility green infrastructure pilot and plan. One of the ideas folks had was to take this, where's the parking lot? That giant parking lot out here, to take that and put some of these like solar panels over it, to put some native plants to help with the water infiltration when it rains a lot, and to create like little pretty areas with maybe edible gardens and places where folks could sit and eat their lunch, public and staff. So those were some of the ideas we like to work on. Next slide. So marketing. One of the things we talked about was let's start hosting events. Like we worked with the aquarium to do World Ocean Day. That was a blast. A lot of kids and families coming in talking about climate change. We had this wheel of hazards. It was really cool. Materials. How do we reduce waste? Use less stuff. So one of the things is installing water filling stations. Thanks to the Wellness Committee, wherever there was a water fountain, they put in one of these filling stations because the plumbing's already there. That was affordable. But apparently there's not all county facilities have these filling stations. They help reduce single-use plastic water bottles. And there's a new recycling system coming out. So supposed to start in July, we'll see. We want to really help promote that. Then transportation is another big area. We wanted to promote carpooling, van pooling. There's a program called Get There Oregon. We don't have to reinvent the wheel. We can, so to speak, we can use them. And then another idea was to replace county fleet vehicles with electric or hybrid vehicles. And as gas prices rise, that's more economically viable, starting with light duty vehicles. And so what's the county doing now? We've got our interdepartmental team. We've got this draft plan that we've developed. We really wanted to make sure before we finalized the plan that all three of the commissioners had an opportunity to review it and weigh in on it. We have the lunch and learns that we're doing. In public health, I'm staffing the climate action team and the climate health group. We're doing emergency preparedness work with older adults. The sheriff's office has done amazing work reducing waste and saving money. They're just incredible. And public works, if you go to the next slide, Andrew Blair sent me these slides. He says he's very supportive of this work and would love to talk to you. His email's on the last slide if you have any questions. He's an engineer. This is a bit beyond my pay grade. But basically, Public Works is planning for sea level rise and flooding. So those are some of the projects in the works with the Mid-Coast Watershed Council. So there's one of the projects, Oxbow Tidal Wetlands. Next one is Yaquina Bay Pocket Wetlands, the culverts. So you can see the tide is coming in. So as sea level rise continues, especially with high tides and king tides, water's going to go in where it didn't. Next. So Anderson Drift Creek Crossing is, you can see on the right, the flooding, basically. So folks who rely on that road, that's a challenge, right? So Public Works has been doing some great, I think, did I see? Yeah. So there's an expert. Next, please. So what are community partners doing? They've been working on this way longer than the county has. They're forming the Oregon Central Coast Climate Coalition. They're working with OSU professor and intern to research climate action plans. They're considering forming a Lincoln County Climate Alliance, community-led. If they do this, they'd like to see Board of Commissioners represented in other jurisdictions. And we really want to build on all our work. We don't want to reinvent wheels. We want to we've got so many amazing organizations and individuals in this county. We really want to just keep nurturing that. And we want to include youth more. One of the ideas is to have a youth advisory committee. And we'd have to pay them to get representation, in my experience. And next. So what's next to adopt the plan? Oh, and Sarah, did you want to share what the county's looking
just
for?
about public health. Yeah, so, part of this plan highlighted some of the things that public health has been doing and does, and Mary Ann highlighted up through the end of this biennium. We're beginning a new biennium, and while Mary Ann is retiring, the work doesn't stop. She's created this amazing legacy of connecting people and gathering information. The public health work will continue. It's part of the public health practice within modernization, and the work that's been done around like the assessment and the creating the plan. We will continue with that plan by embedding this work into additional staff that are already working with our community partner with Benton County on communications around climate and health. Another example is within even our public health emergency response plan. Would be looking at how are we embedding climate and health into our emergency response. So say there's a fire, are we prepared in talking about air quality and what that does to impact our health and how to respond to that. We also, the connection about the youth advisory, that's an ongoing conversation to explore how do we make that happen? How do we embed that in the work? How do we support that? What's the feasibility and what steps would it take? So I think just part of this is really highlighting that the work that has been done continues. And it will continue, and it may just look a little bit different because hopefully we're going to have this be a part of everybody's work within public health of how are we addressing climate in terms of health, in terms of the work that we're doing. So we're pretty excited about being able to continue to support this plan from this perspective.
Thank you.
Yeah. So we had some questions for you, but you might have some questions for us, perhaps?
Okay, Commissioner Miller, thank you for your leadership on this important issue. So I'm turning to you first.
Yeah, no, appreciate, some ideas about continuity and, all the work Marianne has done. And what I saw when Marianne informed me of the work she was doing, I looked at that historical record we have with the Climate Change Partnership and just really wanting to make sure that we have some continuity, look for things we can do inside our organization so we're not, telling people what's best, but not really demonstrating those behaviors ourselves. But just a couple days ago, I'm at the water district, Seal Rock Water District manager, just I went there to meet on a different issue. And he's saying, okay, we're in drought conditions. And it's like, oh my gosh, so the point I'm getting to is the impacts our community is going to have. It's just ongoing. And how are we dealing with that? So I just hope we can keep some internal continuity with the work, recognizing that there is been a lot of work done already for years. So the ship has kind of sailed in some ways. And I just want to make sure we're participating in a relevant way and not overcommitting either. Like, I don't want to overcommit us to things that we can't do as well. So just your support to approaching this discipline and this need in a way that works for everyone is what I'm looking for. So thank you.
Okay. Commissioner Chuck?
Yeah, thank you for all your hard work, Marianne. We appreciate that. And good luck in your next endeavors. How has this plan been folded into the Oregon State's climate action roadmap?
I think there's a lot of overlap. Basically, we've used information from the Oregon Department of Energy. They're the ones that are the primary agency providing grant funding, I think, for a lot of these projects, like around the microgrids. There's a community renewable energy program out there with funding. I think they're in their 4th round. There's a lot of opportunities that kind of overlap with the roadmap in terms of, so we talk about resilience, and that's a word that I don't really like to use it because it's one of those words that's kind of lingo-y, you know, like sustainability. But we need to think about how are we going to bounce back from these extreme weather events? How do we make our communities stronger so that people aren't as vulnerable to these extreme weather events? So I think there's a lot of overlap there with the roadmap.
Thanks. So I look forward to continuing the work, and especially with what's going on out there in the ocean with acidification, hypoxic areas, harmful algal blooms, and things like that. So that's big impact, not just to the community, the visitors, but also the commercial fishing industry and recreational fishing industry. So thank you, and looking forward to.
Oh my gosh. Yeah. And so I moved down from Washington State in the Puget Sound area, and the oyster growers there were really experiencing problems. So basically, the oysters weren't seeding and growing the way they're supposed to. So their industry is really at risk. Yeah. And that's true for so many of our natural resource-based industries. Yeah.
Thank you.
I want to join in saying thank you for your good work on this, Marianne, and the best for the future. Appreciate a very informative presentation, and I think this will give the board a framework to look at how we move forward. So thank you.
Thank you.
Oh,
well,
yeah.
we did have that last slide. If folks, if y'all would like to consider that. So we really wanted to hear from you. So Casey's looked at an earlier draft, I think, but Commissioner Hall and Commissioner Chuck, if there's items you'd like to see added to the draft, if you'd like to finalize it, that would be amazing. Then we could post it on our webpage. We have a climate and health webpage. If there's items you think are not pragmatic and you'd like to see removed, that's great. If there's additional key partners you'd suggest. I think when I first started doing this work, I met with Commissioner Jacobson, and she suggested meeting with Martin Desmond. That's how I started that relationship. He's been just amazing, but I'm sure there's other folks out there who we're not aware of. And if you'd like to adopt the plan, that would be fantastic. Yeah, community members and staff have put a lot of energy into this. It's not just symbolic, we're hoping. We're hoping it actually guides action and kind of informs grant proposals moving forward.
Okay.
So Marianne, you have a little bit of time left here. So can you take any recommendations and integrate those in from the board?
Oh, absolutely.
Okay.
I'm ready and eager.
Great.
Yeah.
Would you send her some thoughts? I would
Mhm.
appreciate
Sure.
it.
And I think on the last slide, there's my email, although it should pop up. And then there's Andrew Blair's contact information too, if you have any questions about Public Works. He was eager to be here, but he couldn't. But yeah,
All right.
please send me any input you have. That would be wonderful.
Glad to. All right.
Thank you.
Anything else?
I'm good. Thank you, Chair.
Okay.
you.
Thanks for the
Appreciate it.
presentation.
Yeah.
Now we're at public comment, and there is a 3-minute time limit. And Mr. Lip, if you could bring forward the sign-in sheet, please.
Like to get a chance to sign in.
Sure.
Marie McFarland. Good morning. Welcome.
Morning, Marie.
Good morning, Commissioners. My name is Marie McFarland, and I reside in Lincoln City. I've been around this county my entire life, which is 79 years. I've been in and out of the county, but I have lived here continuously since 2009. What strikes me most is that I'm seeing a major decline in our cities, especially in Lincoln City. And it's in the matter in which you all spend some of that money that you get. You were elected to be fiscally responsible for our tax monies. However, you're making Lincoln City an uglier city with all the homeless, low income, and mental facility positions that you're putting in the town. And you're putting them right on 101, which were in business areas. So you have taken away business locations to put a homeless shelter on. You're now bringing in a mental facility. You have many homes. There's at least 3 apartment buildings now that are low income, and they're right on 101. These locations are exempt from paying our taxes, and so it impacts the rest of us who have to pay more taxes for the abuse of our city. In addition, they are taking up spaces, as I mentioned, for the businesses where they used to reside. Again, taking away business real estate and tax dollars, that affects all of us. And that is because all government entities do not pay taxes on those facilities. I also believe that since Chairman Hall last meeting announced that the budget is only a roadmap and not set in stone, that's opening up our tax monies for fraud and abuse. A budget is not a roadmap. You should be adhering to that budget and not just shifting monies willy-nilly as you please. On another topic, I am disgusted in the way you've treated Council Member Casey Miller, as you are not working as a team and you refuse to consider his involvement in agendas and other things, and that includes the recent press release. This is demonstrating your unwillingness to hear from the people of our county. In addition, I resent having our tax dollars go to extra office space because of your unwillingness to work together. You have been elected not to be partisan. You are a nonpartisan group, and yet the talk you walk is all about partisanship. This does not end well for anyone. None of you were elected to control us. And as a reminder, you work for us. We don't work for you. Thank you.
Thank you.
Thank you, Marie.
Betty McCain? Good morning, welcome.
Good morning.
Morning, Betty.
My name is Betty McCain. I'm a Lincoln County resident. I'm a senior citizen. I'm on a fixed income. Every 2 years, I have to save for approximately 2 months to pay the registration on my car for my tags in order to drive legally in this state. This is a state requirement. It's there for everybody. Everybody should be complying with this tax. Chair Hall, I've noticed that your car is not compliant with that rule. Your tags are expired. They've been expired since 24. The month is obliterated, so we don't know when in 24 it expired. But I really feel that that's cheating the state out of money that the rest of us have to comply with. So I've talked to our local sheriff, Adam, and he said that he would talk to you about that. He would, if it were any of us, he would give us the opportunity to make it right by talking to us. That was over 2 weeks ago. Nothing has changed. So I don't understand how you can sit up here and chair a committee and not comply with the state law. Thank you for listening to me.
Thank you.
Thank you, Betty.
Debbie Deuce?
Hello.
Hello.
I first
Okay.
want to Claire.
Please state your name.
Oh, my name is Debbie Kozar-Deuce. I want to thank you, Claire, and congratulate you on the groundbreaking we're seeing being done north of Depot Bay and the affordable 12 townhomes that you've worked so hard on. I also want to encourage the commissioners to seriously consider adopting many of the actions that they presented today from the Climate Action Committee. I think that's a very wonderful and that's a very progressive thing that we can do. I'm also hearing, this is very troubling to me. Last week and this week, the complaints about Commissioner Miller, you know, the fact that you are, it's a very broken relationship we have going here. And it would be nice to have a committee that worked together. And I understand that there was some requirements that were put to you, Commissioner Casey, about the breakdown in the communications that happened last year. In order for you to move past that, there were some requirements that you would meet. And I'm just wondering if those have ever been met. So that's it for me. Thank you.
Okay, thank you. Catherine Roller.
Good morning. I'm Catherine Roller, and I moved here to Newport when I retired 6 years ago. And I have watched our community. And I just want to say that I've lived in many, many, many different communities. I was raised as a military brat. I married a military person. Besides living throughout our country, I've lived overseas. I love Newport. I want to recognize that every community has its struggles, and I want to encourage you to set aside personal grudges, personal differences, and continue to lead Lincoln County in the manner that we all deserve. Thank you.
Thank you. Is it Cassandra Mumford?
She's our medical legal
Oh,
death.
that's right. Mary Infante?
Hello, I'm Mary Infante. I live in Depot Bay, and I'd like to thank you for the opportunity to speak to you today. I'd like to thank you also for the professionalism that I have seen here. This is my first meeting, my first Commissioners Court meeting to attend. And despite all of the media coverage about the problems that are going on in the Commissioners Court, I'd like to thank you for displaying the kind of professionalism that you are today. And I'd also, with that in mind, like to urge the commissioners and staff to continue to work together for the best interests of the residents of Lincoln County. And, you know, that is so important, especially now with all of the federal cuts and how that's affecting different programs and services in our county. You know, there's just no other, this is the most important time to really learn, to really unite and work together and get hopefully past all of the differences that are being publicly displayed in the media. So I urge you to do that. I also would like to, along with Debbie Deuce, suggest that you adopt the plans for the Lincoln County Climate Change Action Plan. I really enjoyed their presentation, and I'd like to, see their plan on the county website would be great, and maybe learn ways that we can work with them at different, in different cities or communities or groups that we work with to further their agenda and their plan. So thank you.
Thank you. Christine Hutchins.
Morning.
Good morning. Thank you for letting me speak. My name is Christine Hutchins from Otter Rock. I'm very sad to have to read this because this meeting has been wonderful, listening to all of the work that's being done by a lot of people in this city, or in this county, should I say. However, there's something that I think everybody needs to hear, and I'm hoping that I get to speak all of this without having the meeting shut down. Council Yule made it very clear when she wished to talk to me after the last meeting on 6/4. As there were many people around, she took me back through the meeting room to her office area. Frankly, I was very surprised as we were told by Commissioner Hall during the meeting that there would be no backwards and forwards interaction with the public and that we would be held to 3 minutes. Kenneth Lipp was there behind the glass, and council gave him instructions to make copies of emails. He seemed to know which ones she wanted, although he did ask for clarification on a couple. The emails were between Casey Miller, Quinton, I'm assuming he's media, Sheriff Landers, and Judge Backett. Kenneth Lipp seemed very nervous as his hands were shaking as he handed the documents to me. I received a media release dated 4/16, which was this paperwork. This was all the paperwork I was given. Deflection emails written between 9/13/2024 and 9/17/24, plus an email written by Casey Miller to everyone on 5/25/24. And there was an email from Curtis Landers to Casey Miller dated 5/25/24. Another email from Judge Barkett. Included in this batch was 2 conflict of interest statements by the DA dated 2/4/25 and 6/28/25. Then there's a separate batch of paperwork that Mr. Lipp gave me, including a January 16th email about Casey Miller's investigation and what looked to be a PowerPoint presentation called Lincoln County Casey Miller Investigation. While Mr. Lipp was printing all this out, Council Yule was firm in her conversation that there was a lot of corruption at City Hall. And that because I'd only heard one side, I did not fully understand this situation. I told her that I disagreed. Just so everybody's aware, there were 2 people present during this conversation. So Barbara Davis was the other party. She proceeded to
I'm sorry, but we're at our 3-minute time limit. You have a written statement. We could have copies made and distributed to each of us for review.
It doesn't surprise me, Commissioner Hall, at all that you would do this.
Enforce
the
the
last
rules
person to
equally
speak, so
for
why don't
everyone.
you just let
No,
me-
we also have one more person signed up, and
Okay, thank you.
Michael Allen.
Hello, Michael.
Well, good morning, Commissioners. My name is, for the record, Michael Allen. I'm from Florence, came up here especially for this meeting and to support Mary Ann Seiferd's proposal for a climate action plan. I'm going to give you a little bit of background with why I'm here in the first place and what led me here. Practically 15 years ago, I was with my wife, Pat, an RV traveler, and we were exploring where to live in Oregon. And we ended up, one of our spots here was at the state park at Lincoln City. Wonderful, wonderful little park. But you know, half of it was at that time closed because of flooding. So I started experiencing some of the, as far back as that, climate issues. When I arrived and settled in Florence, I became fairly active about 10 years ago, trying to work with our city to come up with their own climate action plan. And I went even further than that. I explored what was happening on the Oregon scene and nationally, and I discovered a group called Elders Climate Action. And lo and behold, no, they did not have a chapter, but they needed somebody to start it, and here I raised my hand. But that led to a lot of other events. I am also on the Park Advisory Committee for Lane County, and because of that, I was linked up to their climate action planning process. And they have one. About 3 or 4 or 5 years ago, they started the process and now it's in play. And what is the benefit? Well, to the little town of Florence, Florence ended up working directly with their staff after they came up with a climate action plan to come up with federal dollars, and they won the grant to give them a resilience hub, and they picked our senior center. I have to say, unfortunately, because of the climate that we're in, the money has been taken away from that project. So we are going to work diligently to find other sources because the ideas were great. Now, I discovered Mary Ann Seifert through her climate health group, reaching out as far as where we are. And because our elders group is also sponsoring work up and down the whole coast, she mentioned the fact that we're trying to get a central climate coalition going. So that's how I got connected to her. And I'm really pleased to be here and in support. There's a bunch of us out there that are going to work diligently as partners. And I hope that at some point you will adopt the climate action plan.
Thank you.
You're most welcome.
Thanks a lot.
That concludes public comment. Do we have anybody online who wishes to be heard?
If you are in the Zoom meeting and would like to offer public comment, please use the raise hand function.
All right. That brings us to a close of our agenda. I'll remind everyone our next meeting, Wednesday, July 2nd, 2025, 10 a.m. Until then, we're adjourned. Thank you.
Thank you, everyone.